In this video, I'm going to talk about how you can figure out what FND is and what is not for your teen who is struggling with FND, also known as functional neurological disorder. I'm going to show you this algorithm that I have started sharing with the families who are in my online group coaching program, Teen FND Academy. And I figured it would be helpful for you to know as well. So then you can kind of figure out what it is and what you need to do. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy. I have helped hundreds of teens who are struggling with FND and their parents resolve the condition of FND so that they can get their life back and feel like normal again, which is oddly so satisfying and relieving for so many families who have gone through this condition. So today I want to talk about what is FND and what is not. But let's just say FND is an umbrella term to describe this cross-wired problem between the brain and the body, even though your child's brain and body are structurally and physically quote unquote fine. It is a real diagnosis. Your child's not making things up. Oddly, very common diagnosis you would get in a neurology clinic. However, nobody knows much about it. FND is a biopsychosocial phenomenon, which I have tons of videos talking about what that is. And FND comes with so many different terms like functional seizures, NES, non-epileptic seizures, psychogenic non-epileptic seizures, PNES, functional gait problem, functional movement disorder, functional tics, functional Tourette's, functional this, functional that. But they're all part of FND umbrella term. And unlike adult FND, who is said to be related to this childhood trauma, like over 90% of the time, according to some statistics, teen FND, that's like less than half of the case. So it's not the same thing. And I do get some comments from adults who have FND, and I'm so happy they found my channel and then glad that they are engaging with me. I want to make sure that this channel is specific for teens who are struggling with FND, because again, where they're coming from as opposed to adult FND is different. So the strategies and skills that I'm specifically teaching teens and their parents who's struggling with FND are not necessarily identical to adult with FND who has been having this issue for many years, and they're now on disability and things like that. But anyway, let's go back to today's video's topic of how can you tell whether what you're seeing in your child's symptom is FND or not. So I get asked these questions a lot from so many families, both in my private practice and online program and in the community. I get so many emails asking about what about this, what about that. Now that my child is getting better from this condition, but then now there's that happening. So whether it's a sudden pain or sudden nausea or sudden dizziness, or now that my daughter is sleeping all day long and all night long, that kind of thing. And now that my child's seizure episode, the non-epileptic seizure episode, is like hours, kind of thing, right? So maybe it is the same thing, but in a different form or completely different things. So those are the background that I get a lot from so many different families. So here's the algorithm. The step one is know your comfort level as parent and as a family. So what do I mean by that? Are you the kind of family who is going to call the pediatrician for every single detail that you notice in your child? Like, oh my gosh, my child has a runny nose. I need to call my doctor, kind of thing. Oh my gosh, my child has a fever. I need to go take my child to ER right away. So what is your comfort level to begin with? Because that is going to dictate a lot of what you're going to be doing beyond this step one of the algorithm. Okay. So just know your comfort level and really follow that comfort level. And step two, knowing that when in doubt, it is okay, absolutely, to contact your child's doctor, whether it's a primary care physician to begin with, or a neurologist, or whoever gave you and your child a diagnosis of FND, and ask about these concerning symptoms. It is okay. And when you get a hold of them, this is one step further, ask them or talk to them about when is appropriate to reach out to them again in the future. Some neurologists might be available like a concierge type, like 24/7, while other neurologists may not be available for 6 months down the road, kind of thing, right? So you don't have time to just twiddling your thumb and then just waiting for the answer for the next 6 months when your child is having this new symptom, right? So ask them when you get a hold of them, when is appropriate time to contact them. The neurologists that I work with usually say, if it's the same symptom, just assume that this is FND, assuming that you got the FND diagnosis correctly. But if it's a different, like new symptoms, now there is completely different thing, and you don't know if there was an acute injury that is related to it. So for example, your child is complaining of a headache, and like 5 minutes before that, your child just hit her head, like, okay, you hit your head and then there's a headache now, so it's kind of, okay, that kind of makes sense, right? So just kind of thinking about that, which I'm just kind of getting myself ahead of myself, but again, like, when is a good time to talk to the doctor, or when is a time to take my child to the ER situation? For FND itself, regardless of what the symptoms are, there is no medical emergency, so there is no need for you to go to ER, generally speaking. There might be secondary injury happening from FND episode. For example, your child might be having this non-epileptic seizure episodes, for example, and then, or fainted, right? And then like hit her head. Okay, now that she's bleeding out of the head or something like that. Okay, you can't just like wrap it up, and I mean, you can just chalk it up to, okay, oh yeah, that's the FND, yeah, we're gonna not do anything, you need to take care of the secondary injury part, right? But strictly speaking, FND itself is not a medical emergency, therefore ER visit is not necessary. Okay, but anyway, that's a step 2. So when in doubt, contact your child's doctor and then ask what the concerning questions are, and then ask when is a good time and appropriate to contact them again in the future. Okay, number 3, step 3, this is really important for you as a parent and then also child as well, to know that there is no way you as a parent can tell what FND is and what is not. I mean, number 1, you're not a medical provider, but even step further than that, even a lot of medical providers cannot really tell at times, right? They're not able to just see, oh, here's a fever. Oh, that's part of FND. Well, they have to go through the testing and asking questions and then, run the blood work and things like that. So they have to investigate. So just because you're calling them and then asking them, hey, my child is vomiting, is that an FND? There's no way anyone can tell what that is. Okay, so if that is what you were hoping, it's almost like, can you tell when the next lottery ticket number is going to be, kind of thing? Is there a way for you to narrow it down, the possibility or odds? Maybe, maybe not. I don't do any of that kind of stuff, but kind of similar thing. There is no way, but it's really important for you to know that it is okay that you don't know everything about FND and what it is and what is not. Okay, so that's step 3. Step 4 is really nitty gritty. So is the symptom one of the FND symptoms? So what I mean by that is, check my other video of talking about what is FND, or you can also download FND symptom checklist, or you can just Google FND symptom checklist, okay? If whatever your child is having, whether it's a new or old, is one of the FND symptoms, then I want to know, is that new or is it something that they have experienced before? Okay, so those are the things to think about. And then if the answer is no, this is not listed as one of the symptoms of FND, then you want to know what it is that your child is experiencing, how long this has been going on, how often this has been going on, and how debilitating that thing is for you and your child, because you need this kind of information to report to the doctor, who can then ask further questions, narrow it down what might be going on. Okay, again, you're not responsible to figuring out, you are gathering information to support the doctor to figure things out further. If the answer is maybe, like, is that the same symptom, but now it's like longer, more frequent, more severe, and so kind of figure out what it is that you're witnessing or hearing from your child. All right, so that's step 4. Step 5, regardless of the step 4, what you find in the step 4, check your 5 Fs. And this is something that I talk about in my program, Teen FND Academy, as well. So these are the 5 Fs. Are you trying to fight off this symptom? And are you trying to fix the problem? Or are you focusing on this problem like a lot, whether between you and your child? Or are you feeling frustrated or fearful of these symptoms? If you say yes to any of these 5s, once again, is that fighting, fixing, focusing, fearful, or frustrated? Then if you are answering yes to anything, then regardless of what the step 4 is, work on reducing your fight or flight, because all of these 5 Fs are the signs of your fight or flight symptom or system is super high. So regardless of what it is, turn it down the volume of your fight or flight system, because turning it up high does not help for you or your child. Okay, so that's a step 5. And step 6, talk to your child about that 5 Fs. Not only you, but ask your child if your child is also having these 5 Fs or any of these 5 Fs. If the answer is yes, then work with your child to reduce the fight or flight, the sympathetic nervous system overactivation together. And then this is where you can be the role model, like showing your child this is how it's done. And then talk to your child about expectations, meaning assuming that this is part of FND, then what is the expectation? We're going to do business as usual. Yes, you're not feeling great, but we are basically doing business as usual. Therefore, there is no accidental secondary reinforcement about, oh my gosh, there's a new symptom. Now you don't have to do anything. No school, no chores, no activities, no nothing. You don't go there. Okay. And then if that, whatever the symptom that you are seeing or your child is experiencing is brand new and you don't know what it is, and again, go back to step 2 and ask the doctor, right? But assuming this is part of FND, then you are basically teaching your child how to manage the symptoms, regardless of what symptoms is. So think of the symptoms of FND as a bunch of different branches in one tree. You don't water particular branch in a different way because this branch is growing this way versus that branch is going that way, right? Like you don't do that. You just water the tree at the root area, so then everything will grow kind of evenly, right? But let them do their own thing for the most part. So think of the FND symptoms as similar to that. And then so the watering the root for FND is equivalent to your child learning the skills and strategies to regulate their autonomic nervous system. And that's a bottom-up approach. First of all, that is the step 1. Step 2 is to do the top-down approach. So once the bottom-up approach is getting pretty in a good place, meaning that your child is able to regulate the autonomic nervous system pretty relatively good, then it's the next step for them to go on the top-down approach, which is the cognitive behavior therapy. A lot of times doctors will say, oh yeah, go see a CBT therapist, cognitive behavior therapy and psychotherapists and psychologists and all that jazz. I'm not saying don't do that, but that's like a secondary thing. You have to learn how to put out the fire first before you figure out why this is happening, right? Which I'm going to get to it. So again, those are the strategies to manage and reduce the symptoms while the teen is also getting back to her life, like daily functioning stuff, which I have a lot of videos about what to do with that. Okay. So again, autonomic nervous system regulation strategies, and then the top-down approach of therapy and cognitive behavior therapy techniques and things like that. Step 7 is know why symptom fluctuates for your teen. Number 1 question I would ask in this algorithm is, at this stage, is your child even getting the right treatment to begin with? You cannot do DIY or not do anything or see in quote-unquote therapists who doesn't know anything about FND. That is not the right treatment. You're basically going to like a general practitioner for a dental problem, kind of thing. You kind of have to go see a specialist, right? So that's my first question that I would like to ask. And if you are, let's just say, getting the right treatment, then have you and your teen explored these influencing factors? I would say the why phase of the treatment for your teen's FND. Because if not, if I think of the FND as a fire, then the why part is like when the fire is sort of subsiding and then there's amber, then you need to figure out what the amber is or where the amber is coming from, so then you can deal with it to get rid of it, right? If you don't, just focusing on the surface level of symptom management and like, oh my gosh, my symptoms are so much better, then if you don't deal with the why part of it, it'll continue to come up, okay? So again, kind of continue to have this amber at the bottom, and so at any moment, your child's fire can come back, maybe in a different format, or now she used to be able to manage and figure out and then how to deal with the symptom, can't do that anymore, kind of thing, okay? And then sometimes families do mistake that this is a sign, oh my gosh, my teen has to live with FND forever, because we got better, but it came back, that kind of thing. Or they might think out of the fear that they have to practice this forever, the strategies for the rest of their lives. Well, not so fast, I would say, because yes, strategies are important. However, if you're operating from these 5 Fs, as I mentioned earlier, like fighting, fixing, focusing, frustrating, the fear, then you're basically feeding off of this amber because you're cranking up the volume of fight or flight like it's a gasoline. So of course, it'll continue to stay in your child's body as a form of FND. But think about this. You're basically doing the same thing of, let's just say, slow breathing, right? So this is an example. It's a whole different experience if you practice it from this mindset of, oh my gosh, I have to practice this strategy forever and ever and ever, or else this is going to come back, which is completely driven by fear. Or you're actually doing the same thing of this slow breathing practice through this mindset of, you know what? I love slowing down by slowing down my breathing because it helps me feel grounded and makes me feel better. So I am going to continue to do this slow breathing strategy. So you end up doing the same thing, slow breathing strategy, but really it's coming from very different mindset. So then what happens is the outcome is very different. One is constantly driven by fear, which again is feeding off of this amber. So at some point, sooner or later, the FND symptoms are going to come back. And then the other part is that this practice becomes part of their life and it's more like a joy, so it's not about a chore that they have to do. It is literally coming from, you know what, I'm going to do it because that makes me feel good, right? So again, know that symptoms of fluctuates happen while they're recovering from FND, and then are you getting the right treatment, right? And if so, have you really explored the why part? I have had so many teens who got better and they thought, oh, out of sight, out of mind, and then they stopped the treatment only to come back a few months down the road. Oh my gosh, it came back with vengeance. And then lo and behold, they didn't work on the why part. And so what is left is that now they're sort of having a setback, but driven by fear and, oh my gosh, I have to do this for the rest of my life. I'm like, not so fast. Okay, this might be a little bit of setback, but hey, your body already knows what to do. So let's figure out all of those strategies that have worked in the past and then maybe tweak things around here and there. But you can be doing the same thing from a different mindset, not from the fear, right? And then this time, let's make sure that we work on this why part, right? So that is how you can be done with FND. So it goes back to what is FND versus not. Those are the 7-step algorithm that I like to teach my families who are in my program and also in my private practice. So basically, let's make sure your diagnosis is correct. And then make sure instead of refusing what the diagnosis is, just know that. And then in my experience, usually if there is something that's happening suddenly without any sort of preview, like known injury or anything like that, usually, I wouldn't say all, usually that's part of FND. And in chronic pain world, there is this thing called symptom imperative. So basically what that means is a fancy name for the pain location changes throughout the body. So it started with right knee, and now it's both knees, and now it's onto shoulder. Sometimes it's onto head, and sometimes it's wrist, sometimes it's ankle, sometimes it's back, that kind of thing. When there is like a constant moving target, that is called symptom imperative, and it's a basically the same thing as a chronic pain category. Therefore, you don't need to go see a doctor after doctor for having different places, as long as you know what you started as a chronic pain. So FND is kind of similar. So for the most part, the symptoms that you're experiencing might be part of FND. But again, go through all the steps of the algorithm so then you feel better about yourself of what you're doing. I hope this was helpful, but leave me a comment what kind of steps that you found helpful and then what kind of steps you're having difficulty with. It could be your mindset. It could be your comfort level. It could be the inability to reach out to the provider. It could be not having the right approach. It could be so many different things, right? So I want to know more about it. Then leave me a comment below. Well, thank you so much for watching this video. And if you're curious more about how to figure out what to do as a parent and also teens, what to do with school and what to do with all these other situations like holiday, out of town, whatever, follow my channel and then watch so many videos that I have on my channel. Thank you so much again, and I'll see you in the next video.